Greatness is not in any man when he is born into this world. Opportunities available to us as we grow is a key determinant if a child will become great. Opportunities that are scarce in this 21st century. One that creates these opportunities for others to aspire to become great epitomizes sacrifice and selflessness. In March 2003, UNESCO held a seminar on poverty tagged Ethical and Human Rights Dimension of Poverty at All Souls College in Oxford, United Kingdom. Statistics show that 799 million human beings are undernourished, 1,000 million lack access to safe water, 2,400 million lack access to basic sanitation, and 876 million adults are illiterate, while more than 880 million lack access to basic health services. These staggering statistics had been peculiar to developing nations of the world. In the year 2000, at the United Nations Millennium Summit of World Leaders, a plan was brought up to help alleviate these issues bedeviling developing countries. Thus, the birth of MDGs, Millennium Development Goals. This plan has a lifespan of 15 years to achieve the following set goals. 1. To eradicate extreme poverty and hunger. 2. To achieve universal primary education. 3. To promote gender equality and empowering women. 4. To reduce child mortality rate. 5. To improve maternal health. 6. To combat HIV/AIDS, malaria, and other diseases. 7. To ensure environmental sustainability. And 8. To develop a global partnership for development.
Nigeria joined the MDG program basically after 2006, after we had a debt forgiveness from the Paris Club and other organizations. This now formed the budget for financing MDGs across board. So this actually started during Obasanjo's time. The federal government created the Office of the Senior Special Assistant to the President on MDGs, particularly to engage with the states. The essence is to engender or stimulate responsibility on the side of the states by providing a partnership called Conditional Grant Scheme, wherein the federal government provides funds on their own side, which should be matched with the state government. Now, these projects are designed from the state and cascaded upwards for approval of the federal government before it's carried out. So partnership started with the arm extended by the federal government to the state, and some states on their own has taken it upon themselves to take MDG as a target, as a goal to foster development in the states. So federal government on their own have been providing the funds since the inception of the program in partnership with the state. The state government has, on their own side, scaled up this investment by targeting specific local governments with the least human development index. We try not to put our funding where it is not needed. We first start with a lot of assessments to ascertain the need of a project in a particular locality. The state government in its own has invested heavily in the last 3 years into MDGs, so much so that you can feel the impact everywhere. Funding-wise, the governor has invested his own personal commitment and enormous political support towards ensuring that funds are available towards the targets of attaining the MDGs.
I became the Aragbiji of Aragbiji in 2008. Ever before then, I've been hearing of Millennium Development Goals. I was even a member of a committee in one of the local governments because I was a local government staff before I became an OBA. Then it was a matter of MDG very far away from us. But later, we had the first experience, I think around 2009, 2010, when the state government had a major project, a comprehensive health center, which we site at Lagbo Avenue in Iragbiji here. The project has since been completed. Thereafter, around 2012, another one was sited at Egbeda, and that one too is already completed and is being put to use. It's on record that MDG has been also supplying equipment, providing water for the hospitals and for the public. And so far, I can say that MDG project in Osun State is a success story as far as our experience as a community is concerned.
If you look at the development target of Osun, the vision of Aregbe administration, the 6th Integral Action Plan weaves seamlessly into MDG's target and has formed the vector for social inclusion, for socioeconomic inclusion, for wealth creation, for poverty eradication, and for improvement in all sectors: water, health, and environmental issues. Before the advent of Aregbe Shola's government, a lot of projects were not carried out with needs assessment. Instead, you find some wards having multiple facilities, all in the name of political patronage. But our own case, we do exhaustive analysis of the needs for a particular project to be dropped in whichever locality. That's why you find out that most of our projects are where they are needed. You go into the hinterland in the rural areas to find where you probably could not find it easy to reach. You have the effect of the government there by dropping access to water or primary healthcare centers across board.
With a system of operation in place that requires collaboration with the different arms of government, the possibilities of the dividends of the MDGs reaching the people is dependent on the willingness of its government to serve. The success of any system, many would agree, is in the result. This system created to bring hope can only be termed successful if the people truly benefits from it. In a country where there is mistrust between the people and its government, the voice of the people is the voice of truth. And in verifying truth, the people's opinion is the yardstick.
Púpọ̀ fún àwọn nǹkan tí MDG tó ti ṣe fún wa. Wọ́n kọ́ iléèwé níbi táwọn ọmọ ó ti máa kàwé, yàrá 3. Àwọn náà ni wọ́n kó oògùn wá fún wa tá a máa lò níbi tó gbé jẹ́ pé a wà yìí. Àti omi tí ń gbẹ́ síbẹ̀ wọn mọ̀ báwọn náà ni ń gbẹ́. Ẹ ṣeun o, torí ó yẹ kí n fi yín pé yóò tiẹ̀ dá pọ̀ yóò tún ara ìlera wa gan-an náà nù nírú omi tó jẹ́ wípé wọ́n wá gbé síbi omi yìí ṣe wá lóore lọ́pọ̀lọpọ̀. Ilé ìwé tó wà nítòsí bíi àwọn gan-an náà ó mọ láǹfààní àti mọ rí omi mú bẹ̀ dáadáa tí ó sì máa jẹ́ omi tí ó dára fún wọn láti mu.
Ẹ̀ka rí ọ̀gá débi pé ìtọ́jú tí wọ́n ń tọ́jú wa ó péye débi pé kò sí àwọn obìnrin tí wọ́n wá bíi tí wọ́n rògùn dépò aboyún ni àwọn tí ara wọn ò yá ni wọ́n wá bíi wọ́n sì gbóògùn déédéé tí wọ́n sì ń tọ́jú wọn kò sẹ́nìkan tó rẹ́jọ́ rò pé àwọn ò rògùn. Ó sì jẹ́ dùnmọ́nú mi débi pé èmi tí mo jókòó olóṣèlú ni mí lídà kan sì ni mí tó yìí ṣe pé gbogbo ohun tó máa ń ṣẹlẹ̀ ní káńsù mo máa lọ sí lóṣooṣogbo mo máa lọ.
Ọ̀fẹ́ ni o kì í ṣe pé ń gbowó lọ́wọ́ wa o pé bí wọ́n ṣe wọ́n ti fi àǹfààní fún àwọn aráàlú láti wá lò tó yẹ pé wọ́n bá ní fàǹfààní fáráàlú láti lò ní pé bá ti ṣe external tap tí wọ́n ṣe síta yìí so inú ilé ní ìbá limitless so torí pé ti ṣe lè síta lè ṣe àǹfààní ti wà fún aráàlú náà láti wá pọn mi tó ń bá ti wà ní storage.
Inú mi dùn sí torí mi ò ronú pé wọ́n lè wà kọ́rù ẹ̀dán fún mi bí àsìkò ṣùgbọ́n àsìkò tí wọ́n gbé wá bí ẹni ń ṣeré bí ẹni ń ṣeré ni ọ̀pọ̀lọpọ̀ tí àyè sọ pé wọ́n kàn wá bí kíní èèyàn kàn wá bí ṣe bí àbẹ̀wò sàrẹ̀ lásán ni ṣùgbọ́n mo wá ní ìgbọ́kànlé nínú ìjọba àti ìgbọ́kànlé nínú Ọlọ́run pé ńgbà wọn bẹ̀rẹ̀ kíní ìtàfi lè gbé wá sí omi ńlá mo gbà pé wọ́n máa ṣe yọrí.
Now it is obvious that trust exists between the government and the people of the state of Osun. The MDGs came to existence to solve different human issues, and the state of Osun seems to have adopted a program that fits perfectly.
The first thing is, if you have a healthy population, you'll be more productive economically, there'll be better output in every sector. The first target is health. If you look at the integral action plan of Mr. Governor, it's to promote healthy living. It's a very critical part of it. And in MDG goal 4, 5, and 6, it has to do with improvement in mortality rate, that improvement in maternal health, reduction in child mortality, as well as complete eradication of communicable diseases like HIV, tuberculosis. So because of the importance of healthy living, the state government has invested a lot of political support in ensuring that these targets of MDG are met alongside the target of Mr. Governor.
The MDGs program have affected tremendously, especially in the area of maternal health care, reduction in the child mortality rate.
Since the inception of the program in the state of Osun, we have reached, first of all, 62 wards. We have built 62 new primary health care centers, and each of the ward, in most cases, we have more than 10 communities. So if we have to go by that, we have reached 62 wards with new primary health care center, and each ward has, in most cases, about 10, 7, 8, there's some people that have about 15 communities. So then we'll be talking in the range of over 600 communities that have benefited from the MDG health projects.
Many of the projects are health related. They have assisted us greatly in the area of infrastructural development, in the area of provision of medical equipment and consumables, and even drugs in some of the health facilities. So I'm indeed very grateful to the management team of the MDGs office, and particularly to Mr. Governor, the Governor of the state, for the conducive atmosphere he has put on ground for the two agencies to be able to collaborate together. So it's a very cordial relationship, and we are working hand in hand to advance healthcare delivery in the state of Osun.
In this state of Osun, women are treated free, and our children, particularly when they are pregnant women, it's free of charge.
Before the advent of MDG, especially in Egbeda, we were using a very rickety building as the comprehensive health center. But today, the environment of our health institution has a lot to do with the confidence of whoever goes there to receive medical attention. So today, the confidence has been risen to a reasonable level. And apart from that, our people appreciate it.
Ó ti máa lọ bí ọdún mẹ́rin sọ́dún mẹ́ta. Ìtọ́jú tó péye wà fún wa, torí ẹ̀ náà là fi wá sí bíbí. Àwọn ń wá, àmọ́ sì máa ń gbọ́ ọmọ náà wá tára àwọn ọmọ náà bàyà, wọ́n sì fún wa lóògùn. Wọ́n tọ́jú wa, wọ́n test wa, wọ́n dá wa lóhùn dáadáa.
In fact, wọ́n try bí báyìí gan-an. Patient tó bá wá, wọ́n máa attend sí patient dáadáa. Then tó bá wá fún àwọn maternity antenatal, wọ́n try gan-an. So wọ́n dẹ̀ tún bá wọn sọ̀rọ̀ nípa health talk, everything wọ́n máa ń ṣe dáadáa. So bí báyìí wà òkè gan. Wọ́n fún wa lóògùn tó wọ́n bá ní, wọ́n máa fún wa. So ìtàn bá ní, wọ́n máa prescribe ẹ̀ fún ẹ̀, so a máa lọ rà níta. Wọn kì í gbowó kankan lọ́wọ́ wa o. Both injection and tablets ọ̀fẹ́ ni, free ni.
Ilé ìwòsàn yìí ni àkọ́kọ́ ọrú rẹ̀ ní agbègbè. Inú mi sì dùn wípé ibi ìlàkọsí.
Pé ìdùnmọ̀nù mi ni ó jẹ́ àwọn ọmọ hospital tó maternity tó wà ní Ẹ̀bọ̀dè wọ́n mọ̀ mí bẹ́ẹ̀ ọ̀gá tí wọ́n ṣẹ̀ṣẹ̀ gbé dé nìkan náà ni kì í tí mọ̀ mí èyí tí wọ́n gbé lọ àjọjọ fọwọ́wọ́ tí wọ́n ràn wá lọ́wọ́ pẹ̀lú oògùn tí ń sì ń péye àwọn dókítà wa náà sì ń ṣe déédé tó ti pé yẹn tí ẹ lè sọ pé ọmọ ìyá ni láfẹ́ jẹ́ níbi wọ́n ṣe ń tọ́jú wa tó bí ilé oorun mi nu ní sùn kábẹ́hùn ìgbà tí wọ́n bá tó dá àwọn aboyún lóyún tí wọ́n dá gbogbo wọn lóhùn tán lẹ́yìn tó gbóògùn torí èmi gan ara mi ọ̀yá tí mo lọ hospital tí mo tọ́jú ara lára mi tún fi lé ṣùgbọ́n bíi wọ́n tọ́jú mi mo gbóògùn déédéé gbára bá ń ro mí gbogbo ẹnu bá mú mi gbogbo tí ń bá ń dààmú èèyàn pátá lògùn rẹ̀ wà níbí tí wọ́n fún wa a ti ń dúpẹ́ lọ́dọ̀ Ọlọ́run a tún dúpẹ́ lọ́dọ̀ ìjọba tó wà lóde pé ń tíráyì fún wa ń ṣe ń ràn wá lọ́wọ́.
wọ́n kọ́lé kan kékeré sínú gbóǹbẹ̀ yẹn fún wa fúnra wa láti ẹ̀kọ́ yẹn ṣùgbọ́n wọ́n gbé àwọn òṣìṣẹ́ síbẹ̀ tó jẹ́ pé ìbá bí aláboyún náà máa ń wá bẹ̀ so àwọn òṣìṣẹ́ tí wọ́n wá ń bá wa ṣiṣẹ́ ń bẹ̀ wọ́n wá jẹ́ tó wúlò wọ́n rò pé ibẹ̀ jẹ́ igbó wọ́n ń dúró kó jẹ́ pé táláboyún bá ti wá bẹ̀ wọ́n ń dúró tí wọ́n ń bímọ wọ́n dẹ̀ ń tọ́jú ọmọ ń bẹ̀ àwa àgbà náà ìbá oògùn tí ó bá yẹ tí a lè lò tíjọba ń kó fún wọn wọ́n ń lò fún wa tó jẹ́ pé àníwá ṣe eléyìí báyìí ó ti wá fọkàn wa balẹ̀ pé láti gbòòrò fẹ̀tẹ̀ tó pàápàá wọ́n á máa sọ pé jẹ́ lọ sómi ńlá òṣìṣẹ́ ẹ̀tàn bẹ̀ ọkàn wa ti wá palẹ̀ báyìí pé àwọn òṣìṣẹ́ lẹ́nu gba bẹ̀rẹ̀ rẹ̀ báyìí àwọn òṣìṣẹ́ wa ti bẹ̀rẹ̀ sí láti máa sùn bẹ́ẹ̀ kó jẹ́ pé lọ́sàn-án lóhun tá a bá kánlẹ̀kùn ìyẹn á dá wa lóhùn nínú bí báyìí pé ìyẹn á dá wa lóhùn bẹ́ẹ̀. tá a bá ti ní ìdí torí èèyàn àtòru àtọ̀sán náà ń ṣàìsàn so a dẹ̀ ti rí i pé a ti fọkàn balẹ̀ ní omi ńlá àti agbègbè rẹ̀ báyìí pé kò ní í sí pé àìsàn máa ń ṣe èèyàn ọmọ máa sáré gbèdìgbàdìgbà lọ sí ìgboro pé eléyìí à ń dẹ̀ ń bẹ lọ́hùn pé àìsàn tó máa ń ṣẹlẹ̀ ń bí tí wọ́n ní lè ṣe ń bè Ọlọ́run jẹ́ ká rí.
Indeed, good health is wealth, and the bedrock of the progress of every prosperous society. But it takes a responsible and human-conscious government to discern it.
Before Ogbeni came on board, in fact, almost all the hospitals, in Osun were shut down for about more than a year, because of the protracted industrial action on the wages. But when he came on board, there were a series of negotiations and talk and all that. And now, the workers are being paid as a friend, and there is a very cordial relationship because they are motivated.
We have invested heavily in the primary healthcare side of things. The target of the National Primary Healthcare Development Agency is to have a primary healthcare center in every ward. Today, I can say to you that we have achieved far more than 95% of such, if not more. And today, all the PHCs that we inherited that have been dilapidated, we have succeeded in rehabilitating, renovating, actually rebuilding over 100 PHCs across board with consistent supply of drugs, retraining of the health attendants, and immunization, and all the primary services offered in the PHCs are currently being restored in Osun.
Drugs, the MDGs, they've been doing well. They gave us drugs, so we don't have problem with that.
You see that before this MDG came, the hospital was not patronized. Everything has been, the hospital is building is somehow dilapidated. But when they came, they came to revive the hospital. And as you can see now, it's one of the neatest hospitals in this community.
Drugs have been available, but in terms of facilities, I would say the government is trying.
MDGs, they really try, they supply drugs to this local government, and they give us many maternities. In fact, they supply drugs to this local government even every month.
There are some facilities that will supply drugs. There are some that are benefiting from existing drug supply system because the state government has a mechanism, by which all that facility at local government level receive their monthly drug allocation. But apart from that, there are some in the intervening primary care center through the MDG. All right, we have some that drugs were actually supply. Last year, about 22 of those health facilities were supplied with drugs. This year, through the 2013 project, about 27 primary healthcare centers are also being supplied with drugs.
MDG fún wa lóògùn dáadáa. Lóṣù náà wọ́n fún wa.
Commitment and dedication to the health sector in the state of Osun has directly met with the 4th, the 5th, and the 6th goals of the MDGs.
Since the inception of this administration, there has been an increase in the number of HIV clinics.
This is a primary PMCT center, prevention of mother to childhood from HIV treatment. So we attend to pregnant mothers who are positive too, so as to assess treatment and to save the fetus from contacting HIV. We have one positive case, still assessing treatment, but she's about 28 to 30 weeks pregnant now, yet to deliver. But there are facilities for her, even to deliver here. We have been activated and drugs are available. And all she needs to have a safe delivery are also available here. We've not even recorded any maternal mortality case. And we have reduced infant morbidity and mortality rates because they are assessing treatments as soon as they have complaints, and they are being immunized regularly just to prevent any outbreak of any disease.
HIV cases are also going down, in the states. We are no longer high risk state for HIVs.
Kò sí nǹkan kan tó bímọ ṣàìsí àbí ẹni tó bímọ tán tí ẹ̀jẹ̀ ò dàbí kinní kan, kò sí aburú kankan lẹ́yìn ìbímọ wọn. Gbogbo wọn náà ń bí wẹ́rẹ́.
For most rural communities who hold on to many unorthodox beliefs and practices, providing this facility is one thing. Convincing them to patronize it is another.
Wọ́n ti like wọ́n ń wá tó pọ̀ gan. Ó kéré níjọ́ kan, káàdì wa kéré ní 20. Àwọn olùpọ̀ wọ́n wá síbí báyìí. Adégébò wọ́n wá síbí báyìí. Eléwúrẹ́ wọ́n wá síbí báyìí. Táńkókà wọ́n wá síbí báyìí. Bẹ́ẹ̀ àwọn ẹ̀yà kan, àwọn abala kan lájàgbàgàn wọ́n wá sí torí oògùn ta ni. Lóṣù kan 200 tó ráàrin 20 lòdì wọn gbàngbà mi. Torí káàdì wọn ní àkúdà ní 200 taba circulation at the end of the month taba ń kó lọ.
Per day, I would say I see on average 15 to 20 patients. But aside from the patients that we see on an outpatient basis, we have patients that come in for clinics. Like the antenatal clinic is on Wednesdays. So the patients that come for antenatal clinic, I'm not considering that as part of the normal list of patients that we see on outpatient basis.
People have been responding well. They've been coming to the clinic. The turning up is so encouraging.
Abade digbo, abowo jori, abade bisan, abade lai, aboniwede, aberiwe, abatitun, abosewumi, abaro, abatade, igibongbo, abatade, abapanu, abasafejo, àti ababujupa. Ní ọmọ máa jàǹfààní ẹ̀.
Ilé ìwòsàn tá a wà yìí, ó dùn máa wá nú débi pé Ọlọ́run ṣeun. Ó pọ̀ nílẹ̀ yìí tí wọ́n wá ń gbóògùn lọ́dọ̀ wa ń bí. Ní gbogbo agbègbè, gbogbo ọlọ́ta, eléwúrẹ́, bí náà ti agbóògùn. Bí a ti kọ́ mọ̀tálítì ibẹ̀ náà ní táǹkókà wọn. Gbogbo wọn ìrànlọ́wọ́ bíi náà ni. A ní ìwòsàn ju mọ̀tálítì lọ.
Yàtọ̀ fún pé káwọn wá wẹsẹ̀ torí dispensary la ní bí tẹ́lẹ̀tẹ́lẹ̀ níbi pé wá wẹsẹ̀ wá tọ́jú ara bóyá téèyàn bá rí ẹ wọ́n lè dá yẹn nímọ̀ràn pé kó lọ síbi kan òun là ń ṣe níbi tí a wà yìí tẹ́lẹ̀tẹ́lẹ̀ kí ó tó ṣẹ̀ṣẹ̀ wá gbé ilé rẹpẹtẹ tó jẹ́ ilé ìtọ́jú yìí kí ó tó wá fi fún wa níbí.
Ó ti pẹ́ ẹyọ kan.
Ó ti pẹ́ díẹ̀ àti lò ibi bá mo ti bí kan síbi tẹ́lẹ̀ mi bẹ́ẹ̀ ni sà bẹ́ẹ̀ ni sà ibi báyìí là ń lò láti lẹ̀ kò sí problem kankan Ọlọ́run ò jẹ́ kí wàhálà wà.
lẹ́nu ìgbà tá a dé bí ọdún kan sẹ́yìn a ti gbẹ̀bí tó ti tó bíi 10 tàbí jù bẹ́ẹ̀ lọ torí pé bí ibi maternity tuntun ni òun ló fà ṣùgbọ́n báyìí àwọn olóyún wa ti ń pọ̀ tí wọ́n ń wá wọ́n a sì nígbàgbọ́ pé láìpẹ́ ọjọ́ Ọlọ́run á jẹ́ kí wọ́n mọ bí wẹ́rẹ́ wọ́n á túbọ̀ máa pọ̀ sí. bẹ́ẹ̀ ni àwọn fúnra wọn ni wọ́n ń polongo bíbáyìí àtàwọn tó rẹ̀ àwọn fúnra wọn náà ń polongo wa pé kán mọ̀ bọ̀ wá o pé bíbáyìí à ń ṣiṣẹ́ dáadáa ọ̀sẹ̀ọ̀sẹ̀ báyìí náà dẹ̀ wá ń forúkọ sílẹ̀ láwọn tó ń ṣẹ̀ṣẹ̀ lóyún àtàwọn tó ti ń wá tẹ́lẹ̀ ọ̀sẹ̀ọ̀sẹ̀ ni wọ́n mọ̀ ń wá bó ṣe yẹ kí wọ́n wá.
People of this local government, they enjoy them very well.
The educational sector has also recorded tremendous transformation in the state of Osun.
In fact, it has really helped us. The project came at a time we were in dire need of accommodation. The school is thickly populated, and there's hardly anywhere we could put our middle school. But then the building was handed over to us. So it just came solving the major problem we would have encountered. And we have a staff room there, we have the VP's office there. So our vice principals would have been sitting under the tree. But the project just came and we were able to accommodate them conveniently. The program is a laudable one, and it's very timely, it's suitable, and it's coming at a time we need it. The school is very fortunate because it's not the only MDG projects we have. There was a time some computers were brought to the school. It really helped our students in this e-learning thing. It has really helped us a lot. Even if you see the chair I'm sitting on, the MDG provided it.
We really enjoyed the building more than the other building they erected here. The quality of material they use is very okay. The blocks they use, the cement they use, and others. Then the materials inside are very okay. Are better off than the other one we are using before.
The introduction of the world-acclaimed, international award-winning device called Opoimo has revolutionized the delivery of education in the state. Further to that, you look at the issue of feeding in school. Today, in terms of the enrollment rate, Osun State has the largest enrollment rate in the country today, because the elementary school now have all the kids, well over 180,000 kids being fed.
Tí a bá ní ká wò, ó ti bẹ̀rẹ̀ sí láti ìgbà tí ọ̀gbẹ́ni gómìnà wa Abdulrauf Arẹ́gbẹ́ṣọlá tó ti dé ní program yìí bẹ̀rẹ̀. Ètò ń jẹ àwọn tó ń wá fún wa ilé ni wọ́n ti ń gbé wá. Pàápàá ní ilé ìwé tí wọ́n ń bí àwọn márùn-ún ló ń dáná oúnjẹ ìwá. Tó jẹ́ pé àwọn márùn-ún kálukú wọn ló ní kúlà tiwọn tí wọ́n fi ń gbé wá. Tí wọ́n dẹ̀ ń sá fún ọmọ wa lóòrèkóòrè dédé. Kó tó di pé oúnjẹ ìdé àwọn ọmọ wa enrollment wa fígọ̀ enrollment wa ó dínkù. Wọ́n gbà tó oúnjẹ ìdé ọmọ bẹ̀rẹ̀ sí pọ̀ sí ilé ìwé lóòrèkóòrè day in day out là ń gba ọmọ wọlé. Ọmọ mi wà tó jẹ́ pé tó bí bá mú wá gan bó ń ṣe àárẹ̀ bó bá ń ṣàárẹ̀ bó tó mọ̀ pé òun ó jẹ ilé ìwé kò sí àdúró sí ilé ìwé kò lè lọlé.
Education is free in the state of Osun. Uniforms are given to them. The elementary, the entry stage, feeding, we feed children from elementary 1 to 4. So why won't people send their children to school?
Look at the integration of the feeding part, the provision of the services, and the total number of people who are involved in this process. The state government actually got about 3,000 caterers involved.
Fún àwọn ọmọ olóúnjẹ ni ọjọ́ Monday wọ́n ń jẹ iṣu àti ata díndín pẹ̀lú ẹja. Tuesday wọ́n ń jẹ ráìsì àtẹ̀wà pẹ̀lú chicken. Wednesday ẹ̀wà bread pẹ̀lú ẹyin. Ọjọ́ Thursday ráìsì àti ọbẹ̀ ẹ̀gúsí pẹ̀lú chicken. Friday wọ́n ń jẹ àṣàrò àti ẹ̀fọ́ pẹ̀lú ẹran nọ́mọ̀.
You look at the average weight of these kids, they are not malnourished, they are well fed, and it makes teaching and learning, a process that is successful currently in the state.
It helps the pupils to grow well, and it says they are coming to the school regularly because they like the food given them, and it gives them a balanced diet.
Ní ẹnu ọjọ́ mẹ́ta ìjọba gbé ètò kan jáde, wọ́n ní ká wọn àwọn ọmọ ìwò, àwọn wọn wò bí wọ́n ṣe rí níbẹ̀rẹ̀ táàmù. Ìgbà tá a tún wọ̀n wò tẹ́ bá rí ìwọ̀n tí wọ́n wọ̀n, ó ti lé sí nǹkan tí measurement ni mo sọ weight wọn ó ti lé sí lẹ́nu bí ìjọ mẹ́ta. So àwọn nǹkan tó ń ṣe fún wọn ni wọ́n.
Solving the issues of illiteracy and malnutrition at the same time systematically is an act of genius. An initiative that is a hallmark of a people-oriented government. It is clear that the government of the state of Osun and the MDGs have overlapping and interwoven goals. However, these goals are impossible to achieve without a responsible leader.
This administration is run by a very amiable governor, an unusual governor, that believes that there should be a bridge in the gap. The way we work in the state of Osun is not where you have the civil servants here and then the political office holders. No, you have to synergize.
Even if a contractor is given a job, the MDG office in Osun will ensure that they lock horns with the contractor to such an extent that until the contractor gets to, meets their target, they will never allow the contractor to rest. One of my friends got one of the jobs. At a point, he came to report to me that the pressure from the MDG is too much. And I said that is better. There is monitoring, there is supervision, there is standard, there is excellence in MDG in the state of Osun.
Nígbà tá à ń dúpẹ́ lọ́wọ́ Ọlọ́run, tá a tún dúpẹ́ lọ́wọ́ ìjọba wa ní ìpínlẹ̀ Ọ̀ṣun àti MDG tó jẹ́ pé wọ́n ṣe ètò yìí, àǹfààní ńláńlá náà ló jẹ́ fún wa.
Òsì dáadáa sọ fún pé a mọ rírì rẹ̀ lọ tó pé èèyàn ò lè ronú pé nǹkan tó dáa báyìí kò lè fò jáde. So tí wọ́n bá dé ṣe nǹkan náà next time ni pé kéèyàn appreciate wípé gọ́ọ̀mẹ̀ntì ṣe nǹkan, kò sí nǹkan tá a lè ṣe pé ká mọ rírì rẹ̀ lọ ká sì maintain rẹ̀ ká rí pé a lò dáadáa pé kò tẹ̀ bá daṣẹ́lẹ̀ nígbà tó jẹ́ pé kò sómi ẹ̀rọ ní inú ìlú tó ń flow.
Ó tún ti pọ̀ sí kó jẹ́ pé a ní mú mi oníràwé mọ́ tí kòkòrò máa tọ̀ sí tí ewé igi tá máa tọrọ sí àti ní ìgbọ́kànlé pé kò ní sí àìsàn kọ́nẹ́rà gan lẹ́gbẹ̀ẹ́ wa mọ́ nígbà tí èèyàn bá ti mú mi kó mi.
We are grateful to MDG and we pray that it's going to be a continuous one because it's a grassroots one helping the people.
Àgíngbowó torí ọ̀gbẹ́ni Arẹ́gbẹ́ṣọlá gbogbo nǹkan náà fi ń tà wọ́n lóúnjẹ lọ́rùn táwa náà dẹ̀ fi ń tẹ́ àwọn ọmọ yẹn lọ́rùn.
MDG has a record of successes in project execution.
The poverty level rate in Osun is far, it's about 157% better than the national average. Osun is about 61% and the national average is about 38.8%. It makes it second in Nigeria according to statistics to Niger State.
We have met up to 95% in achieving the set goals in the MDGs.
Recently, some women were selected for a kind of program to alleviate their poverty. I think it is also MDG project.
Osun State will be empowering about 2,250 beneficiaries in a program we call conditional cash transfer. Before now, we have paid in a program under the social safety net to those we call Agba Osun, the old and the vulnerable group, about 10,000 naira stipends every month. And Mr. Governor had decided to scale this up to add to another 2,250. Now this is called conditional cash transfer. The essence of this is we are paying cash to them on the basis that they are accessing the facilities the government is currently building. For those that have had health facilities in their locality, we're paying them to ensure that pregnant women who go to the health facility to have access to both pre and postnatal treatment. They were ensuring that we're paying them because of increased enrollment of children to school to reduce the number of out-of-school age children on the street.
I know, because MDG has no record of failure.
The government has not failed in its responsibility.
In terms of success, State of Osun has clearly proved itself as far the peak of the pack in terms of achievements that we have recorded so far. Communities that have not seen the impact of government in several years before now are feeling our impact. They are commending the government, which they have not seen before now. Ours is not for show, it is driven by clear assessment of needs.
In a country where majority of its populace grieves over the insensitivity of government, the people of the state of Osun are grateful.
I want to appreciate the presidency and the state government of Osun for the prompt payment of their counterpart funding, and especially in the creation of enabling environment towards the attainment of the various achievements.
We thank MDG, we thank the governor state of Osun, we thank the Federal Republic of Nigeria.
A government that inspires its people to greatness is an indication of selflessness. Greatness, they say, is not the amount of wealth a man acquires, but it is in his integrity, his ability to affect those around him positively, and in the excellence of his chosen career. Governor Ogbeni Rauf Adesoji Aregbesola continues to show excellence in leadership.